The gluteus, hamstring, and the calf muscle forms the posterior muscle chain. Let's discuss about the functional anatomy and the training. Glutes max, which is a monoarticular muscle which crosses the hip joint, and it arises from the posterior part of the ilium, sacrum, and then the sacrotuberous ligament. In this, the upper 3/4 of the fibers has insertion to the iliotibial tract, which is nothing but the thickening of the fascia lata of the thigh, which is the deep fascia of the thigh. Whereas the lower 1/4, it gets attached to the gluteal tuberosity of the femur. The glutes max is an important muscle for our erect bilateral stance. Next is the hamstring muscle. This is the lateral hamstring muscle, which is nothing but the biceps femoris. These are all biarticular muscle. This is semimembranosus, and that is semitendinosus, which forms the medial hamstrings. All the hamstrings are biarticular, which crosses the hip as well as the knee. The semimembranosus, as the name suggests, it is membranous structure which arises and gets attached to the ischial tuberosity, whereas semitendinosus, as the name suggests, it has a longest tendon. This is the biceps femoris long head, which goes all the way and gets attached to the ischial tuberosity. And that's the biceps femoris short head, which has attachment to the femur. It doesn't cross the hip. And it also has attachment to the lateral intermuscular septum, which is nothing but the infolding from the fascia lata of the thigh, which is a deep fascia. Also, that is the vastus lateralis, which has attachment to the lateral intermuscular septum, which is a part of the anterior group of muscles. So the lateral intermuscular septum separates the anterior from the posterior group. So that's the conjoint tendon, which is formed between the semitendinosus and the long head of biceps femoris. So before it gets attached to the ischial tuberosity, both forms the conjoint tendon and gets attached to the ischial tuberosity. That's the short head of biceps. That's the long head of biceps. And that's the semitendinosus, which has a long tendon. That's the semimembranosus, which is more of membranous structure. So all these forms the hamstring muscles. Next to the calf muscles, it includes gastrocnemius and the soleus. That's why it is called as gastrosoleus. Gastrocnemius, it's a two-joint muscle. It crosses the knee as well as the ankle. That's the medial part of the gastrocnemius, which arises from the medial femoral condyle posterior aspect. That's the lateral gastrocnemius head, and they unite to form an aponeurosis, which extends down to form calcaneal tendon along with the soleus muscle, which is a one-joint muscle. So these are the gastrocnemius. If you reflect the gastrocnemius, both the medial and the lateral head, you'll be able to find a monoarticular muscle, which is the soleus, which also forms a part of a gastrosoleus, the calf muscles, which crosses only the ankle. That's why it produces only ankle plantar flexion. It gets attached to the fibular proximal part, posterior aspect, and the fibular head, posterior aspect, as well as the soleal line, which is present on the tibia. There are various training strategies to activate this posterior chain of muscles, and let's see one by one. So number one is standing calf raise, where you perform active heel lift. So this will activate the gastrocnemius mainly, as well as a little bit of soleus activation. Since the knee is extended, the gastrocnemius is activated quite a lot. These are all unilateral heel lifts which challenges the gastroc more. These are seated calf raise, where the knee is bent, make the gastrocnemius actively insufficient, so the soleus will work more in order to perform the heel lift here, ankle plantar flexion. This is glutes kickback. Again, here hip extensors work, but here the hamstring, since it is actively insufficient by flexing the knee, the entire force or the maximum force is generated by the glutes max. This is hip thrust, where he performs hip extension Also, along with the hip extension, he performs active ankle plantar flexion. So this activates the glutes max, hamstrings, and the calf. Here, this is the split squat. So this will activate more of gluteus maximus as well as the hamstrings and the quads. But the glutes max activation is more here. Also, it challenges gluteus medius. So this is glute bridge where glutes max is quite active. So this will be able to activate the gluteus maximus efficiently. Even hamstring activation is there. This is the hip extension where you can see the activation of glutes max. Along with the glutes max, hamstrings as well as the erector spinae also acts in order to perform this movement, which forms the posterior chain of muscles. This is dumbbell deadlift, where you perform a trunk flexion and extension with a band. Here again, the entire posterior chain of muscles along with the erector spinae work in order to perform these movements. These are all dumbbell throws using band. In this, you will get good activation of the gluteus maximus as well as the other extensors, but the major action is the glutes max. So this is squat. Even though all lower limb muscles are active, glutes max, quads, hamstrings, and even calf are slightly active in this. So there are various forms of doing squats. So based on that, the muscle activation pattern varies. But here again, the posterior chain of muscles is involved quite a lot. This is the eccentric contraction and this is the concentric contraction while performing a squat.